Tom, thanks for coming in a little early this morning.
Of course.
Whew, I wanted to take a few minutes before the day starts to talk about a new type of appointment that we're going to be routinely scheduling from now on for our more mature patients, starting with those with the most complex medical issues. Now, it's a conversation that I like to have with all my patients at some point in a normal visit, but with the older patients, it's particularly important. You're going to be getting calls about it as soon as our scheduling system is ready to go, within a day or two. And let's hope our pay system is ready as well.
For sure. So what are these new appointments about, Dr. B?
It's called an ACP. It stands for Advanced Care Planning.
Advanced Care Planning.
Right. And it's different from the other visits we schedule for our patients. That's why I wanted us to talk about it, to explain it.
Please, tell me about it. I certainly need to know what to say when the patients call.
Exactly right. And Tom, if I haven't said this lately, I hope you know how grateful I am for how friendly and courteous you are with all our patients, even when it gets crazy around here.
Thanks, Dr. B. A lot of these folks feel like family by now.
Well, that's because of who you are. So, advanced care planning. As you're very aware, we have many older patients with many chronic illnesses, and as we both know, how quickly their health can get worse. We have lots of medicine to treat them, but at a certain point, that may not be the best way to go. So now we'll be booking an entire 30-minute appointment called Advanced Care Planning for the patients and their families to talk with me about themselves, the future, what's important to them and gives them pleasure, and how the patient wants to deal with their illness as it progresses. Basically, that's what the ACP consists of.
Wow, that is a difficult conversation. Scary even. Talking about health getting worse.
Especially when we'll also be touching on the healthcare proxy. And we're sending them home with one to sign. Yeah, it's all very delicate. And I hope during the visit I can minimize some of their fears.
Well, that's why I always try to stay cheerful, Dr. B. My grandmother had cancer, and I used to try to cheer her up and never talk about the cancer.
Well, that was very kind of you, but believe me, patients know what's happening to them. And sometimes they're so worried about their families, they play along and try to be cheerful too. So, I'll invite my patients to come and talk with me about the ACP. If they say no, well, that'll be okay, but I hope they make appointments with you to come in.
Yeah, me too.
Now, the patients and their families may be really nervous when they call to make the appointment and come in for it. And I know you'll be your patient and understanding self.
Of course.
Questions? Okay. Mr. Rosario will be one of the first to call. When he came in for the follow-up to his ER visit, he agreed to schedule the ACP.
I'm glad. I've been worried about him lately.
Yeah. And just to be clear, when Mr. Rosario calls, schedule his appointment for one of the new slots we have available.
Ah, those are for the ACPs.
Correct. And if patients ask questions about this visit, don't worry about having the answers. Just know we'll be talking about the future. If they need a call back from me, leave me a message and I'll get back to them.
Will do.
Okay. To work.